Hi everyone, this is a Tweak of the Week video, but this week I thought I would go back over this fat transfer procedure that I had to my face before Christmas, which I know a lot of you have been asking if you can see a bit more detail on it, a bit more how I felt about the whole thing. I've written it up here and there. There are various videos already online. So a quick recap. This is a procedure known as Svf Facial Rejuvenation. I'll come on to what the SVF stands for in a minute, but it's using stem cells taken from your own fat to regrow and rejuvenate the face. Now, we think of stem cells as something that you find in bone marrow, or I certainly did, but you also find them in adult fat, and they are the healing cells of the body. So they're dormant when they're sitting in your fat, but if they're extracted and woken up and re-injected into the face, they will go to work to heal whatever they see needs healing in there. So this is a big old procedure. I had it done by a brilliant surgeon called Mr. Tunc Tiryaki at the Clinic. I was offered this procedure. He asked me to be a demonstration model for a whole meeting that was going on, surgeons from around the world at the Royal Society of Medicine. And it's a procedure that I've been really keen to try for years because it's part of an area of aesthetics called regenerative medicine, and that means taking tissues from the body, so platelet-rich plasma from the blood or stem cells from the fat, and using them to regenerate other parts of the body. I mean, it's used a lot in medicine for joints or trying to repair the heart and things, so it's not just a cosmetic thing. It's a procedure I've been really interested in because, you know, as we get older, the face is basically shrinking, that we're losing bone, we're losing muscle, we're losing fat. And for that reason, it's like a balloon shrinking inside and the skin all drops down. If you have a facelift, it just tightens everything over that shrunken frame. Or as Mr. Tiryaki put it, it's a bit like having a dress hanging loose on its hanger rather than being filled out from within. And you can do that filling back out of the contours of the face with injectable fillers, but they will only hold on to water there and last for a year, maybe two, and then they disperse. Whereas if you do that reboosting of the face from inside with fat, and it can grow its own blood supply and live in that new place, you stand the chance of getting a much longer lasting result. And using stem cells, which are used to sort of rebuild the bony arches of the face, these three, in the chin, the cheeks, and round the forehead, can also help to give that longer result. So this is a big old procedure. I mean, it's not really a treatment because there's anaesthesia involved, general anaesthesia in my case. I thought it might be just sedation, but I was advised that general would be better. And there's liposuction, then the fat that's extracted, it was about, I think, 8 tablespoons worth of fat, has to be purified and then kind of minced up into a liquid that is centrifuged to pull off the stromal vascular fraction, that is the SVF that I mentioned earlier. And this is a kind of broth brimming with stem cells which are capable of all the regeneration. So some of the fat is kept as filler, some of it has the stem cells extracted from it. And then there's kind of 3 layers of regeneration that go on in the face. First, the stem cells are injected at bone level, so into the bony arches of the face, those 3 around there. Then the fat is used like a filler mixed with stem cells because that gives it a better chance of surviving in the new place where it's being put. That went into my temples, into the brow arches to build them back up, into the cheeks, into the jaw, the chin, and also a bit into my nose. And this wasn't something I just went and jumped into. You know, I've been doing treatments for 20 years. I tend to know a good deal about a procedure before I embark on it. As I said, this was something I've been really curious to try. I'd met Mr. Tiryaki earlier in the year and interviewed him a lot about his work. It sounded fab. You know, this opportunity came up to try the procedure, so it didn't take me very long to consider it. And people have been asking me, weren't you worried about what you might look like? Weren't you worried about the anaesthetic? I think, well, not really, because once I made up my mind to do it, you know, I knew I would be in very good hands. I discussed the detail of the procedure a good deal with Mr. Tiryaki beforehand, so I kind of knew what I was in for. So the procedure went smoothly, I gather. Obviously, I was out for the count. The person who I feel a bit guilty about was Kai, the photographer from the Daily Mail, who had come along to take pictures. And, you know, I'm sorry, mate, that was a really, really tough, hardcore thing to put you through, but it shows you what was going on. And then afterwards, I mean, here are some pictures of what I looked like immediately afterwards. You can see there's injection marks on my face. You can see where the various bits of fat have been injected. You can also see there's some scratchy marks on my face, which were from the final stage of the procedure, which is microneedling, and microneedling the remaining stromal vascular fraction, that's the stuff with all the stem cells in order to work those into the skin for skin reconditioning. So you're stimulating the face at the bone level, replacing the lost fat for added volume and reshaping, and then resurfacing the skin. So afterwards, people are asking, was it painful? It wasn't painful so much as kind of stiff and sore. After about 24 hours, my whole face stiffened up because there'd been so many needles through it and all this new fat in different places, and my nose was glowing like a light bulb because there's not much room to cram extra volume in there. The only bit that actually hurt was my thighs from the liposuction. That was really sore, and I had to wear compression shorts over those. Lots of bruising, but you know, least of my concerns. And then it was just a question of slowly recovering from that, because, you know, this is a big procedure. And what I did put up on Instagram after 48 hours, you know, I kind of hit a low point where everything was hurting. My throat was sore from the tube that had been down it. You know, you sort of think, oh, what have I done? And that is a difficult point. I put a video up on Instagram about that. I'll link to that as well. And all sorts of people came back to me very shocked, saying, you know, what on earth is this? But I thought it's disingenuous to sort of have a before picture and then a month or so later say, hey, wow, it was all fab. You know, with any procedure, you get a dip like that afterwards. And this was a bigger than usual procedure, bigger than usual dip. But slowly it all settled down. I had to go to an awards ceremony 7 days later in order to present a prize, which was a bit of a challenge because I couldn't smile. The whole central section of my face was so stiff I could only sort of smirk like that. And my colleagues, and they were a bit startled, and they said I looked a bit like a caricature of the kind of work that I'm always trying to avoid, you know, the overdone cheeks, the swelling. My lips were a bit stiff as well because Mr. Tiryaki put just a thread of plain stem cells around the edge of them, not to boost them, just to strengthen them, but it just meant that everything was a bit stiff and sore. But one thing I did before I went for the procedure was to get some 3D pictures done by Nick Sinclair of Surface Imaging, because he's got this amazing camera which can produce a rotating 3D model of your head, so we can see the changes in volume. And again, I'll put those side by side here. These changes look quite slight, but you know, I wasn't aiming on being made into a kind of cartoon of myself. I wanted to be looking a bit fresher. I wanted that sort of the sag taken out of my face, just to prop up the cheekbones, to lift this whole area a bit, to redefine the jaw, which I think this has done. I know you will want a kind of definitive before and after, which is quite hard to do because I think I'd rather wait a few more months. I think all this is going to go on developing because the stem cells are working their way into the skin and regenerating that. The interesting thing is the way this tightens from the inside out. So because it's lifting the face outwards, it's not like a kind of brow lift where everything just goes north. It's coming out in a 3D way. So we'll see. But I'm thrilled with it. I mean, some people looked at the stuff I've put up so far online and said that's far too hardcore, and for the price, which is about £7,000, not what they consider enough. But enough of a result. Again, you know, it depends kind of how much of a change you're trying to make. But I hope that was helpful as an overview of how this whole procedure went. Also, massive thanks to the Cadogan Clinic and to Mr. Tiryaki for his brilliant work. This isn't a sponsored video, but obviously, as I said, I didn't pay for the procedure because I was a demo model for this international meeting. But what an opportunity to try a most incredible procedure. And yeah, like I say, I'm really thrilled to have had it done. So that was this week's Tweak of the Week. I hope you found it interesting.